Preventing the spread of COVID-19. Throughout history, there have been many pandemics, including malaria, which has killed 5% of the people to ever live. And in today's world, there are many seasonal pandemics, including influenza, which kills as many as 61,000 people per year, according to the CDC. However, since the beginning of this year, there's been an emerging pandemic called COVID-19 or novel coronavirus. Since then, the World Health Organization has declared COVID-19 an international health emergency, causing widespread media attention. However, according to the National Institute of Allergies and Infectious Diseases, COVID-19 is extremely similar to past pandemics such as SARS. These similarities extend to the way in which COVID-19 started in bats, then spread to a vector species, and then into humans. And also, as you can see based on these maps, COVID-19 started in Eastern Asia and then spread to the rest of the world, just as SARS did. A major similarity between COVID-19 and past pandemics is the economic impact. According to Daisuke Wakabashi, a New York Times reporter, many bellwether companies such as Apple and Nike have started to show decreased production and sales due to their close marketing and manufacturing ties in Asia. And as you can see based on this graph, during past pandemics, stock prices have taken a major hit due to the pandemics. On January 23rd, China quarantined Wuhan and surrounding prefectures, somewhat slowing down the spread of COVID-19. However, infected individuals had already left Wuhan, and since then, 92,000 cases have been identified across the world. Given the mounting impacts and negative economic effects of COVID-19, there's been a large push to find a solution.
The first major solution would be vaccinate the population. Now, this would be easy because it would prevent a lot of needless deaths and things that happen. According to the CDC, the first time the body is introduced to a germ, it takes several days to make and use the germ-fighting antibodies and get over the infection. After the infection, the immune system remedies and remembers the vaccine for later. And this is what a vaccine does. It introduces the virus to the body in a non-harmful way so that the body can create antibodies so it can fight it off when it comes in contact later. Now, there's one main problem with this, especially with COVID-19, is there's not been a vaccine that has been implemented yet. Now, according to Sean Ratliff, a writer from Healthline, there are two companies that have started or are very close to starting testing on humans. That is Moderna and Inovio Pandemics Incorporated. Now, they're about 1 month away from starting tests on animals, and Moderna especially is projected to start testing on humans in about 3 months. Now, this is good because they're going along well, but it's bad because if they go too fast, then they can make a lot of mistakes. The second solution would be modeling. Now, there are two main sources of modeling. They'd be using NASA satellites and aptameric sensing. Using NASA satellites, NASA already has 14 satellites that constantly take pictures of Earth's surface. So that'd be very good to use because that's basically what this is about. The satellites collect data about the Earth, and it also shows what affects the spread of the virus, which are climate, precipitation, and vegetation of an area. Now, a meeting in American Society of Tropical Medicine found out that with the help of NASA's 14 satellites and their program, scientists have found a way to help monitor and predict the spread of the pandemic. Now, the next one is aptameric sensing. In aptameric sensing, they send aptamers out to the world, and they bond to the pathogens in the world, and they're very attracted to them, which is a good thing. And they're very easy to get to. Tests only take about 15 minutes, and they're very easy to go through because it's very easy to turn around. Now, the main problem with both of these modeling is the acceptance in the world, because there's already a ton of ways that people already diagnose and see pandemics. So they have to stop things like immunoassays, molecular techniques, and other things like that. But if these processes work, it would be very good if they would stop the spread and county days for COVID. Now the final solution is full-scale preparation worldwide. And now it's very easy because if they're prepared, then they can stop the spread of the pandemic, and it wouldn't even take that much work. Now, one interesting thing is all the masks that people are buying aren't even that effective outside of hospitals. As I met Jake Dunning, a worker at the Public Health of England, they're very helpful in clinical places like hospitals to stop the spread to the doctors, but outside of that, they're not even that effective. He goes on to say that the main thing that would stop the spread is keeping good hygiene. If they keep a good hygiene, then it would stop the spread, and it would be very beneficial. But the main problem with this is it wouldn't just be full-scale preparation. You would also have to include a thing like vaccines and things like that, which would help effect.
As shown throughout our presentation, vaccines appear to be the most effective solution to prevent the spread of pandemics. However, it is difficult for us to utilize vaccines without the help of modeling, because in order to make vaccines, we must identify when a pandemic is occurring. This is why modeling and vaccines in tandem are the best methods to prevent the spread of pandemics. According to Bruce Wiley, a professor of health policy and management at the City University of New York, implementing a program in which a company vaccinates all of its employees will be relatively inexpensive, with a cost of less than $35 per employee. This could actually save employers money by reducing the number of employees calling in sick, and would ultimately increase production and reduce losses. On a nationwide scale, Richard D. Smith from the University of Exeter in London says that vaccination with a pre-pandemic vaccine nationwide could save 0.13 to 2.3% of gross domestic product. A single dose of a match vaccine could save 0.3 to 4.3%, and 2 doses of a match vaccine could limit the overall economic impact to about 1% of gross domestic product for all disease scenarios. Although all of these impacts are great, they would not be possible without the help of modeling. Using NASA's satellites, we can track the spread and development of pandemics. In this way, we can detect them much earlier. At the American Society of Tropical Medicine and Hygiene meeting in Philadelphia, researchers concluded, with the help of 14 satellites currently in orbit and the National Aeronautics and Space Administration's Applied Sciences program, scientists have been able to observe the Earth's environment to help predict and prevent infectious disease outbreaks around the world. This shows that we already have the technology to monitor pandemics and prevent them. We simply need to figure out how to be more accurate in utilizing it. In the case of COVID-19, we have not yet found a vaccine, partially because scientists haven't had enough time. If we had used modeling to help detect the outbreak when it first began, rather than allowing it to develop undetected in Asia, we could have allowed ourselves more time to develop a vaccine and potentially created one for people in countries that were not yet affected in order to better protect them. The other problem that arises with the use of vaccines is their use in poor countries, because these countries will likely not have the resources necessary to manufacture large quantities of the vaccine in the event of a pandemic. In conclusion, modeling and vaccines are the best solutions to help prevent the spread of pandemics. Some advantages of these solutions are that vaccines are very effective if given in time, as shown by Richard D. Smith's study, and modeling has already been used to prevent pandemics, showing that we already have the technology necessary. Some disadvantages of these solutions are that vaccines can take a long time to be prepared for public distribution, as is the case with COVID-19, because even once we develop a vaccine, we still have to test it and make sure that it is safe to give to humans. A disadvantage of modeling is that although it works sometimes, we have also let some pandemics such as COVID-19 slip through our fingers, and we need to become more accurate in utilizing this technology if we are to use it to prevent pandemics.
Thank you, Nick. I'm going to go ahead and start with you, and then I'll just go down the line. Reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
I think, Aiden and Jacob's papers both talked about modeling, which is something that I wasn't aware of before, but Jacob's paper went into more depth about that solution. So I think his paper is the one that provided more insight for me creating this presentation, because modeling is something that I hadn't really heard about before working on this project. And so learning about how there were different types of modeling with NASA satellites and the apnumeric sensing, and just learning about how those work and what those do for the solutions, I think, is what made the biggest impact for me.
Okay. And Aiden, what's an example of a compelling argument from Nick or Jacob's paper that you decided as a group to exclude from the team presentation, and why?
So in Jacob's paper, he talks about how a large change in genotypes, which is like the genetic makeup of a disease, caused the disease to be much more volatile because humans don't have resistance to that disease, and that's what's happening with COVID-19, where there are no known like previous human exposures to COVID-19, so it's not possible for humans to be resistant to it already. But we didn't see a place for that in the presentation because we already described the magnitude of the issue, so we didn't use it.
Okay, thank you. Jacob, can you give one specific way that your thinking changed as a result of learning about Nick's work?
One specific way my thinking changed was how Nick went into the economic ways of how vaccines can like help and how cheap they are for like business to vaccinate their employees, which is only $35. So that kind of helped me show how important or how easily vaccines can go through and how they can help.
Okay, thank you.